Thank you for joining me today as we explore what to avoid in an equine chiropractor. Before scheduling an appointment, I think that it is important that you watch the person work either in person or on a video so that you make sure that their technique is adequate. First, if the person does not have a website or the information that you get from searching the internet is negative, please do not contact this person. Second, if the person does not take time to evaluate your horse's issues with you over the phone, they cannot rule out that your horse's issues are chiropractic and you will waste your money. Third, it is important to avoid anyone with inadequate training. It is very difficult for anyone who is not a human chiropractor or a veterinarian to be properly trained because in most states it's illegal for them to adjust horses. Fourth, it is imperative that you use someone who knows when not to adjust your horse. If your horse is suffering from a neurologic condition, lameness, a vaccination reaction, or is in need of dental work, they will not hold an adjustment. Also, a horse should never be adjusted that's about to undergo medical or surgical procedures such as castration or joint injections. One of the most offensive things that I see in the field is people who quote-unquote adjust horses using gimmicks, such as an activator, mallets, a mallet and a dowel, or ropes. All of these things can cause your horse to get into the fight or flight mode during an adjustment, and they should all be avoided. In my hand, I have an activator. And the reason that I believe that you should never use an activator to adjust a horse is it's scary. I'm not going to adjust him with this, but I'm going to get close to his atlas. And that's scary for a horse to have done, and it doesn't provide enough power to actually make an adjustment. Another procedure that I consider to be unacceptable is a person that uses two mallets to adjust a horse. The procedure is that you place one mallet on the vertebrae to be adjusted and you hit it with the other mallet. Now, you can already see that this horse is in a fight or flight mode. So by the time that I adjust two or three things, this horse is going to be so tight through his body that I'm going to have to put so much pressure on this that it's going to create soft tissue damage and bruising, which is completely unacceptable because anyone who has adequate training can adjust the entire horse using only their hands. Another technique that I find absolutely abusive that you should never let someone do to your horse is adjusting it with a mallet or a hammer and a dowel. The theory is that you put the dowel on the area of the horse to be adjusted and then you hit it with the mallet or the hammer. The final gimmick that I'll discuss with you today is the use of a rope to adjust a horse. The only two reasons that a person would use a rope to adjust a horse is because they have been inadequately trained or they're afraid of the horse. Another reason I think it's important for you to watch a person work prior to scheduling an appointment is there are people out there working on horses who are just way too aggressive. If you are very physical about a chiropractic adjustment on a horse, you're going to stretch soft tissue, which is muscle, ligament, and tendon, and those things are necessary to keep the chiropractic alignment in place after an adjustment. If you stretch them, they can't do their job. Anyone who recommends anesthesia or sedation to adjust your horse should be avoided because the brain needs to register these manipulations that we're doing to these horses so that they can ask the body to reset. Typically, a horse will need to be adjusted every 6 to 8 weeks. So be careful of someone who's asking for more frequent rechecks. If a horse needs to be rechecked more often than 6 or 8 weeks, it either has a bigger problem that's not a chiropractic problem, or the person isn't thorough enough to get the horse adjusted to where it'll stay. Be aware that you have no recourse against lay chiropractors if they injure your horse. There's no license to take away. They don't carry liability insurance, and your equine insurance will not cover damages inflicted by an unlicensed practitioner. Thank you for watching this video. I hope that it helps you to understand you should never hire someone based on price. You should always hire them based on experience. A doctor who pays for training, continuing education, licensing, and insurance brings much more knowledge to their treatment protocol. I'm Dr. Mark DePaolo from All Star Equine, brought to you by DePaolo Equine Concepts.